Okay, I'm going to start with a little thought experiment. Imagine you have $7,500. You want to give those to charity. You want to do the most good possible with this. And here are your options. Okay, is there a trick to... Okay. You could give directly and double the annual income of 7 households in poverty. You could give it to... This is going to be fun. You can give it to the Against Malaria Foundation. I don't know what's happening, guys. But you could distribute bed nets and save a life. You could give...
You can use the laser pointer with that, and you can show.
Okay. Go back in time and technology. You could save a life with bed nets. You could give group psychotherapy to 60 women with depression in Uganda. Or you could treat 8,000 children for deworming for a year. And all of these interventions are quite different, but you want to know how much good they do, how much impact do they have, and how can we compare them in order to make decisions about where to allocate resources. And maybe in your daily life, this dilemma is slightly different. Maybe you're a decision maker or someone making decisions about policy, and you're looking at different interventions and making decisions. And you want to know what's the impact of these things and how can I compare them. And the first step here is to decide about what matters to us. What is the impact? What is the good that we're thinking of? Often charity evaluators, decision makers, researchers, they tend to report things in terms of how much income has been created or how much consumption has been increased or how many people have been treated. And all of these things are good, but they're only instrumentally good. They're good for a reason. It is good for me to have income because I can purchase things. Why is it good that I can purchase things? Because they provide this or that. Why is it good that they provide this or that? Because et cetera, et cetera. And as you go further along that line of reasoning, you start getting into the domain of what counts as ultimately good for someone, or what philosophers call well-being. So you want to get at what really truly matters and not stop at instrumental goods. There are quite a few different definitions of well-being. I'm not going to go into detail here. I'm going to focus on subjective well-being. So well-being is about how people feel and think about their lives. My aim is not to convince you that well-being is the only thing that matters, but that it matters a lot. And that your moral system should account for things like happiness and life satisfaction, and for sure that those should be considered as more ultimately good than things like income. All right. Okay, we care about well-being, that's the outcome we care about, but now we have to measure it. And there's two kind of general ways of doing this. The first one is to take all these instrumental factors of income or health and make sort of educated guesses about how good these are for well-being. Or, and this is what we suggest, if you care about well-being, you should measure well-being. And you can do that most directly by actually getting self-reports of well-being. So if well-being is something that individuals have within themselves, this is about their feelings and thinking about their life, then you should ask them about it. And you can do that with scales like how satisfied are you with your life on a scale of 0 to 10. This is not an invention from us. This is a growing area in the social sciences. And you have big organizations like the OECD providing guidelines for government organizations about how to measure these things. This is an example of the OECD's core questions for well-being. Also, we're not just interested in well-being at one point in time. If you have an intervention, we want to know about the good it does in terms of well-being over time. And so if you take the change in well-being that your intervention does, integrated over time, you get well-bees, well-being adjusted life years. I'm going to kind of explain how these work. On this graph, you have people's well-being over time. In blue, you have the well-being these people would have without your intervention. And in red, you have the well-being that your intervention adds. And one well-being is a 1-point increase over a year, or kind of any kind of equivalent combination of this. And all of this red area are the well-bees that the intervention is producing. And the intervention can produce well-bees by improving a life or by extending that life. And I'll come back to that with more detail towards the end of my talk. Okay, I've presented two ways of measuring well-being, but it's a genuine question of, well, is any of those two ways better than the other? Well, the first question, if we want to do this educated guess about different instrumental factors, then we have to think about, are humans good at making guesses about well-being? And the answer from the literature is that not really. Humans tend to fail when it comes to forecasting how they'd feel in different situations or in the future. And I think a really good example of this is this study where they asked people to do time trade-offs. Time trade-offs is the basis for the QALY. So you ask people who don't have a certain condition how many years of life they'd be willing to give up to not live with a certain condition. And when people do time trade-offs, they kind of consider having a small mobility problem to be just as bad as having mild depression. But when you actually ask people with small mobility problems and depression about their well-being, depression is much, much worse in terms of its impact on well-being. So not only are people making a mistake in terms of forecasting how they'd feel with different conditions, they are underestimating how bad mental health problems can be for well-being. Okay, the next question is, well, can we trust people's self-reports of well-being? The first good thing is that it's not a guess. It doesn't depend on people making guesses. It's people actually reporting their well-being, people in the conditions, not decision makers making guesses about what's good for people. Another thing is if you're doing these educated guesses about instrumental factors, if you miss out an instrumental factor, then you've missed out a big chunk of the good that your intervention could do. So imagine you're doing an intervention to reduce loneliness and the only instrumental factor that you're measuring is income. Surely you're missing out on something quite morally relevant here. Whereas if you're getting at people's well-being and asking people to report their well-being, then you are directly getting to everything that's relevant. As I mentioned, this is a growing area of research, so it's not just us, it's groups like the OECD, government organizations like the ONS in the UK measuring well-being. And these measures have been statistically validated, so they're reliable. They don't just give random answers every time you use them. They're valid. They get at what they're trying to get at. I think a good example of their validity is this map of life satisfaction across the world. And you can see here that countries that are poorer, have more public health issues, maybe governance issues, tend to be less satisfied. And countries that have crises like Venezuela and Afghanistan are also less satisfied. So it is getting at what we want these measures to get at. Cool. Back to the example. So we care about well-being. The best way to measure it is self-reports. What does this look like when we actually do this comparison, when we actually try and measure the good that all of these interventions do and compare them between those? And this is the work that HLI has been doing for a few years, and I'm going to present now to you. The first step is that we looked at studies, RCTs of cash transfers and psychotherapy in low and middle income countries. We looked at over 80 studies and ran meta-analyses on them using subjective well-being as the outcome. And we calculated the effect over time for an individual, as well as the effect on the household or the spillover. So if your intervention improves the well-being of someone, it's quite likely that it's also going to affect the well-being of people around them. And so if you don't measure that and don't integrate that into your model, you're missing out on an important factor of the good that your intervention is doing. And sadly, this part of the model is often neglected. It's rarely measured. And it's something that's just kind of starting to be actually quantified and measured. And then you take all of this effect, divide it by the cost, and that gives you the cost effectiveness in well-bees of the intervention. And here you have the kind of summary results comparison of cash transfers and psychotherapy. You can see that they do similar kind of, each intervention does a similar effect in terms of well-bees, but it's much cheaper to provide group psychotherapy. So that makes Strong Minds 8 times more cost effective. And just to be very clear, I'm not saying give psychotherapy to everyone. I'm saying give psychotherapy to people who need psychotherapy, and that's a cost-effective way of increasing well-being in the world. The next step of our investigation was to look at deworming, and I want to make quite clear here the kind of contrast in data available. So we went from a meta-analysis of many, many, many studies to one RCT of long-term effects of deworming that happened to have subjective well-being data. It's the same one that everyone uses for looking at the effect on income, but it had subjective well-being data. We analyzed it and found no significant effect. And on top of that, the literature on deworming in general is kind of controversial, lots of mixed results. So this doesn't warrant a recommendation, it warrants more research into the effect of deworming on subjective well-being. Okay, so that's kind of 2 interventions out of the kind of recommendation running. The next step is how can we compare the effects of bed nets and psychotherapy, where an important factor here is that bed nets are primarily about saving lives and psychotherapy is primarily about improving lives. So you might think, well, on your graph earlier, Sam, it was quite clear. Surprise. It was quite clear. You take years saved times the well-being level, and that's the well-beings you've produced. But actually, there are 2 important philosophical questions here. One is, what's the correct account of the badness of death? And the other is, where's the neutral point? Where's the point in the scale where people go from positive to negative well-being? This is a bit of a weird and complicated conversation. People don't really like conversations about how to compare quantity and quality of life. I'm not going to go into detail. I'd just like you to bear with me as I make 2 points. One is that the answers to these questions make a difference to the results. And 2, that whilst it's complicated, it's not only for well-being. Anytime you're going to make these kinds of comparisons, even if you don't use a well-being approach, you have to think about these things. So first, it affects the results. Here's the cost effectiveness in well-being of the different interventions across different values of the neutral point. This blue dashed line is strong mind, so it's not affected by the neutral point because it's primarily about improving lives. All of these other lines, that's the surprise. All of these other lines are the Against Malaria Foundation under different accounts of the badness of death. And the important point here is that most of these lines are below the strong minds line. So in most of the cases, strong minds is more cost effective. But in one case, which is under the account of deprivationism, under deprivationism, below a neutral point of 1.7, you have strong minds being less cost effective than the Against Malaria Foundation. Okay, and then my second point, this is difficult and weird, but it's unavoidable. Implicitly or explicitly, these choices are being made when you make these comparisons, and it's not specific to well-being. So your healthcare system is making decisions about whether to treat lethal or non-lethal conditions. DALYs, which is our measure of health, has a point that's 0, and DALYs used to have a certain account of the badness of death, and now they have another one. So it's any system that's trying to do these comparisons has to, in some way, answer these questions. All right. Away from the complicated conversation about comparing quantity and quality, a point I wanted to make is this has been a lot of our research over the past few years, and currently we're doing a lot of exploration to find new cost-effective interventions, and we're looking forward to have more recommendations. Here are my key takeaways. I have 2 points to make. If this is the only thing you remember from this talk, this is it. The first one is that we can and should measure what matters, well-being, and we should do that with the most direct method, which is self-reports. The second is that when we use this methodology, it can have really important implications for our priorities, notably that improving mental health in low and middle income countries can be a cost-effective intervention. And I have some stuff to say about how you can get involved in well-being and this framework. The first is, yay, well-being matters, but very few decisions are being made based on well-being. For example, I mentioned that OECD is kind of giving guidelines to government organizations about how to measure well-being, but the step from measuring to then making decisions based on well-being is another one. So if you have capacity and interest, you can convince people to use well-being as the framework of impact. Another one is that there's still very little data about well-being, especially when it comes to interventions in low and middle income countries, which is what we're interested in. So if you're in monitoring and evaluation, if you're in a charity, if you're funding charities, please add measures of subjective well-being. They're quite easy. Here's 2 examples: a life satisfaction question, a happiness question, 0 to 10, simple question. I'm happy to discuss this more if you're thinking of implementing these in any of your surveys. Then you can do more research because there's not a lot of it. You can do theoretical research, like research that we've been doing on comparability, linearity, and neutrality. Another area of interest for us is how do different measures of well-being might give different answers or might be comparable between them, or the kind of practical work of doing cost-effective analysis of different interventions in terms of well-being, or diving into a specific practical topic like spillovers. I mentioned that's quite neglected. And then just if you're interested, there are cost-effective interventions to improve well-being in the world. So you can donate to Strong Minds. You can read The Elephant in the Bednet, which is our paper about comparing improving lives or extending lives. Or you can read our shallow reviews on lead, pain, and immigration if you want to get into stuff that has been only very shallowly reviewed, but to get some inspiration about potentially cost-effective ways of improving well-being in the world. And you can get in touch with us. We have a website, we have a mailing list. I have an email address if you want to ask me questions. And after this, I'll just hang out for a bit to answer questions. And you should just check out in general the work of my colleagues, Michael Plant, Joy Maguire, and Ryan Dwyer. I want to make it very clear that all of our work has been a kind of big collaborative endeavor, especially led from the very beginning by Michael Plant and Joy Maguire. So thank you to them, and thank you to you for listening.
Thank you. We have time for 1 or 2 questions.
I just wanted to, can you switch back to the, yeah.
Okay. I managed to answer that one. Am I doing the questions? Yeah, go ahead. Yeah, I'll try.
As far as I know from the psychology research, sometimes there is discrepancy between the self-report in terms of like remembering self and the experiencing self. Is that accounted in the self-report you explained?
So generally, we're asking questions directly. These questions are asking people in the moment, how are you feeling or how are you thinking about your life? So it's not about kind of retrospectively making a decision, but it does. You might think, well, because life satisfaction involves thinking about your life over maybe a longer period of time than happiness, and often these questions are asked with different periods of time, maybe you like one more than the other. Usually the OECD recommends, especially for affect or happiness questions, they say make it as close as possible, say today or yesterday. So the effort is always to have these questions well made and used well in the surveys. Another thing that happens is if you ask people other questions before the subjective well-being questions, that can affect their responses. So I ask you about your relationship and then I ask you how satisfied are you with your life. That's going to affect how you answer that question. So that's why these questions are recommended to be asked at the top of your survey rather than at the end.
Maybe to add a bit on that, there are questionnaires where you may ask different questions regarding how you regarding your affect, how you experience different emotions, and how you overall satisfied with your life, and they might do different results. Probably we need to account for both of them over time. I mean, as the research becomes more sophisticated.
Are you saying we should ask both affect and life satisfaction questions?
Yes, if I'm not mistaken, in the current holistic well-being research, there are at least 5 areas that are typically taken into account, like positive, negative affect, engagement of flow, relationships.
Yeah, so that relates to the big list I didn't go into of different definitions of well-being that each kind of have related measures, and affect kind of breaks down into measuring positive, negative, different types of emotion, or just going for happiness. And so in the recommendations, they have a bunch of those, depending on how much time you have and how much depth you want to go into. Yeah?
Do you think that inside the effective altruism community, is there like important focus on mental well-being inside the organizations that actually organize different causes?
Do I think within effective altruism, there's an interest in the well-being of people working, in the well-being and mental health of people working in effective altruist organizations? I think it's been growing. There's organizations like yours and like Rethink Wellbeing that kind of have an interest in that. There's been quite a few forum posts and Slack messages about taking care of one's own well-being or taking care of the well-being of individuals. I think that's growing. I think that's great. Our focus has been on actually the mental health of other people matters as well, and it's a cost-effective way of doing good to take care of that. But as with in general, because measures like I mentioned, the quality and these time trade-offs underestimate how bad mental health is, and because of issues of stigma and kind of awareness about, oh, is there ways of actually helping people with this? I think in general, there's always going to be a bit of resistance to work on to improving people's mental health. That's the end of question. Thank you very much.